do you think about acupuncture as treatment for spasticity? And what about cannabis for spasticity? Now, full disclosure, these are not my areas of expertise. So acupuncture definitely has evidence that supports it. Anecdotally, I have patients that do get acupuncture and they report that their spasticity is less. So I would say definitely if you have the money, insurance doesn't usually pay for it, it's worth a try. I would say that if you do it and you're not noticing a benefit, then I would say probably not to continue. But there's plenty of patients that I've had, and there is evidence that supports the use of it for spasticity. Cannabis, same thing. I have patients that swear by it. They definitely report a decrease in symptoms. The one thing I would say that when I was doing the research for the sleep video that I just did, the one thing I would say is they do believe that it disrupts your sleep, even though you can fall asleep and maybe stay asleep because your body is so relaxed. The sleep architecture, so going through the REM, non-REM, and the REM stages of sleep, it changes that or it distorts that a little bit. And they do think there's health, obviously, because I just made a whole video on it, but they do think that there's downsides to your health with not having the proper sleep architecture, meaning not going through the appropriate stages of sleep at night. But on the flip side, I would say this is a very nuanced topic. Obviously, if you Google it, you'll see every opinion possible under the sun on this. But on the other side, if it helps you sleep and your spasticity is so bad that you can't sleep, is it worse to not sleep, or is it worse to be able to go to sleep and maybe just not have perfect sleep? And then I would say you just have to try and figure out what works best for you. But there is evidence that supports it. Downside is there's also evidence that suggests that it does mess your sleep up a little bit. But again, I am not an expert on these topics, so I would definitely talk to your doctor. I've brought this up before, but I do think a PM&R, physical medicine and rehab doctor, is the best type of doctor. They are all about finding non-invasive ways to treat movement-related disorders of any kind. So I would say that that would be the best type of doctor to try and find to get answers to some of these questions. And I'd get a few different opinions.